Seeking medical care, it really is not a positive experience. And as we explore inequity in care, we are hearing experiences just like this.
I had a doctor who really did not listen to anything I said.
Can you relate to that? If so, you're not alone. In fact, black people are significantly less likely to be believed when they say they're in pain. In fact, a 2016 study showed 40% of first and second year medical students still believe the false idea that black people's skin is thicker than white people's. In part one of our Inequity in Care series, we introduce you to some of the doctors, patients, professors, and other advocates coming together to break this cycle. Well, today in part two, we're diving deeper into how sharing these personal stories will make a difference. You know, sometimes you really have to laugh. Oh, you guys know the story?
Oh, I got stories for days.
The running theme.
To keep from crying, Kim Weaver and her family endured a fair share of both.
My daughter has 2 birthing stories that she almost died through at 2 different hospitals.
Her daughter was in labor, just 27 weeks, bleeding profusely, requesting pain medicine doctors say they ordered, but never did. Thankfully, both of her babies lived. But for this now grandmother, there was even a bit of deja vu. You see, years ago when she was having her first child,
I had premature labor.
She gave birth to a stillborn.
But before that, they had gotten a heartbeat. And so while I'm in labor, they're saying, well, your baby's been dead for weeks. And I'm like, no, they had a heartbeat downstairs. And they're like, not possible.
Turns out she was carrying twins.
And it took a nurse coming upstairs saying, yes, I did have a heartbeat. There was a baby still there for them to realize I was still in labor and having another baby that they weren't prepared to help save.
Walk me through how you felt.
Oh, I was, in that moment, tired. I mean, I was 19. And what do you do when you're arguing about they had a heartbeat downstairs in the emergency room and the nurses are telling you that's not possible? I was not being heard. And I think I was not being heard because I was a young black woman.
A lot of people are not aware that they have bias.
Including medical professionals, which is why educators at the University of Kansas Medical Center are prescribing an ounce of prevention rather than a pound of cure. You see, these 3 people are on the front lines of something called the Repair Project, performing surgery on the syllabus and curriculum for future doctors. Dr. Jason Glenn is the project's primary investigator and executive director.
It's based on one simple premise. How do we at academic medical centers repair the harms that have been done over the past centuries, not just in the mistreatment of people of color in the clinical encounter when we go to see the doctor, but also in the misrepresentation of people of color in the curriculum.
So the project aims to address racism in medicine from 4 angles: curriculum development, continuing medical education, addressing unequal health outcomes, and collaboration with the community. Dr. Geraldine McGee and Daniel Binion both work in the Office of Diversity, Equity, and Inclusion for the University of Kansas Medical Center.
So it's important for me that healthcare changes, right? And that it's more equitable, not just for people who look like me, but for all people who are marginalized.
I think it's really important for faculty to own up to what we're teaching, and that's one of the things that they're doing. So they're taking a look at the curriculum in order to make those changes.
And people like Kim Weaver sharing their stories, which will then be used to break down stereotypes and build trust.
So if we can provide a space that they can be heard and we can validate them, and then we know that we can use that again to help change how curriculum and students learn, we can change it for future generations.
So tomorrow in part 3, we'll take a closer look at KU Medical Center's Repair Project and how they'll use stories like Kim's to change how current and future doctors treat their patients.